Welcome to the Healthy Matters Podcast with Dr. David Hilden, primary care physician and acute care hospitalist at Hennepin Healthcare in downtown Minneapolis, where we cover the latest in health, healthcare, and what matters to you. And now, here's our host, Dr. David Hilden.
Hey everybody, it's Dr. David Hilden, and welcome to episode 12 of the podcast. Say, have you ever heard of a treatment that involves stepping inside a pressurized chamber and breathing pure oxygen? Well, it might sound like something designed for deep-sea divers or astronauts, but, it's actually also a powerful, evidence-based medical therapy that's saving limbs, treating life-threatening poisonings, and helping stubborn wounds heal. And we do it right here at Hennepin Healthcare in downtown Minneapolis. So today, to talk about hyperbaric medicine, what it is, how it works, and why sometimes the simplest element in the room, oxygen, can be one of the most powerful tools in modern healthcare. To help us break it all down, I'm joined by Dr. Tom Masters. He is an emergency medicine and hyperbaric medicine physician here at Hennepin Healthcare. Dr. Masters, welcome to the show.
Thanks for having me.
Great to have you here. You and I have done some other things before and talked about this, so I've learned a little bit about hyperbaric oxygen, and I remember walking into this hospital 30 years ago. It was literally 30 years ago. And when we had an old submarine over there on 6th Street in Minneapolis, we don't have an old submarine over there, but we have our new, modern, evidence-based hyperbaric program. Can you tell us what, in its most simplest term, what is hyperbaric medicine?
So hyperbaric medicine is giving super high doses of oxygen to people, and we accomplish that by having them breathe oxygen under increased pressurized environments. You can't give it in a pill. You have to be in a special room where we can close the doors and increase the pressure. There's a bunch of different ways to do that. The one that I think most people are most familiar with is what we call a monoplace chamber, which is a tube. People always describe it as like an iron lung.
Yeah, it kind of looks like an iron lung, doesn't it?
Yeah, a little less confining than that. It's got acrylic and you can kind of see through it there, but it surrounds you. We have that, and we also have what's called a multiplace chamber, which is a room that is steel enforced with big steel doors, and you close the door, and we've got massive compressors above you that increase the atmospheric pressure, and then you put a mask on and breathe oxygen under pressure.
Sounds to me like a Jules Verne novel of 80,000 Leagues Under the Sea. I don't even know if I got that novelist right. It does sound like 80,000 Leagues Under the Sea, and people right now are picturing like a submarine. And I did say that at the beginning. It's sort of, the old one kind of looked like a submarine.
We do.
What does it look like now?
We do kind of lean into that. Our roots are in undersea medicine, and we do see divers, so recreational divers and commercial divers. So we are in the land of 10,000 lakes. So we do have people that do underwater construction work in the upper Midwest.
But Doctor, we are like 1,000 miles from the nearest ocean.
We are, but we've got Lake Superior right above us there. So our roots are in undersea medicine. So we take care of injured divers, but most of what we see in the Midwest, because we are so far away from oceans, is individuals with medical issues. The chamber itself, we have lights that kind of make it atmospheric, like you're underwater, but it feels like any other room, really, once you step in there. It's a square room with just...
It's white. It's not some old gray steel thing.
Yeah, we treat everything here at Hennepin. So we'll have kids and we're like, okay, it's like you're going in a spaceship. So, that's kind of the analogy we use with them. But it's got windows and it has electronic devices in there, so TVs and everything that's checked for fire safety before you go in there. But it's a pretty comfortable environment. You sit in a recliner while you're in there and just relax for a couple hours while you breathe that high pressure environment.
Listeners, I've been in there many times, not for a treatment, but just because Dr. Masters and his team let me look around in there every now and then. It reminds me, and I'm not trying to be flippant, it reminds me of the first scene of the first Star Wars movie, the white hallways with chamber pressurized doors. It is comfortable in there, but it is something that not many people do every day of their life. It is a weird thing. It's like you're going into a spaceship or a submarine. Could you tell us at its core, what is the basic principle? Why does high dose oxygen under pressure do something in our bodies?
So kind of at its most basic, I tell our patients that it's like we're like a bottle of soda pop, essentially. So in soda pop, you increase the pressure and you can dissolve carbon dioxide in that soda pop. When you take the lid off, all those gases come bubbling out. For us, we're mostly water. And when you breathe oxygen under increased pressure, the same physics applies. So oxygen will dissolve into our tissues. And you can get up to 10 times the amount of oxygen you would get under normal circumstances in a hyperbaric environment. The initial effect is if you have an area that is hypoxic or lacking a lot of oxygen, you can get a higher dose of oxygen to that. But then, interestingly, there's a bunch of physiologic effects that it has as well. So it can trigger blood vessel growth, decrease inflammation, and help patients when they have problem conditions.
So does the oxygen just get forced into the tissues then? That's a crude way of putting it, and I know it's not just like that. But.
It's not entirely wrong, though. I mean, again, it's just basic physics. So when you increase the pressure, you increase the amount of dissolved oxygen, and then you create, again, if you remember back to high school physics, a diffusion gradient. Oxygen travels further from an area of high concentration to a lower concentration, and so you're able to pump up the amount of oxygen in tissues.
That's helpful, really helpful, except the part about high school physics, which I've been actively trying to put out of my memory now for years.
Exactly.
No, but that's exactly what it is. So how long have we known this works? Is this something new?
No, this is something that we've been doing since really the late 1800s. We've been seeing people that we've been treating with pressurized gases. It's come more into develop more science since like the 1960s and onward. And then we continue to refine things and discover new conditions that would benefit from this as science develops.
And we've been doing it at Hennepin a long time.
Yeah, our first chamber that you referenced earlier was built in the 1960s. It was before I arrived here.
Folks, it looked like a Jules Verne novel or like an underwater bomb. It looked like this roundish kind of thing.
So it actually had that round area that you're talking about actually was an operating suite. So the idea, and again, Hennepin was kind of leading the charge on this, was that you could hyperoxygenate people, so give them super high dose of oxygen, and then perform cardiac bypass surgery on their heart while it was still beating. So that's why it had the OR suite in it. Then the heart-lung bypass machine got invented, so it never really came into vogue. But that was something that we were leading here in Minneapolis.
So the new one then, I call it the new one. It's probably not so new anymore, but I remember when it was built. We kind of built the building around it, and it was shipped from Australia. Okay, could you tell us about the current chamber?
Yeah, so we opened in 2012. We are one of the busiest medical hyperbaric centers in the country, right by the Viking Stadium. We've got 3, we call them treatment locks, so 3 individual rooms that are all interconnected. We can treat 8 patients at a time in our biggest one, and then 2 to 4 in the other ones, and we can send them down individually. And one of our chambers has a toilet in it, so if you have a really long treatment or a patient has an issue, they have a toilet available, which is nice.
A toilet under high pressure, what could go wrong?
I tell people it's like the toilet on the bus. Like don't use it unless you need to use it, but it's there if you need to. So always nice to have.
That's wise advice, actually. Who actually needs this kind of therapy? What are the most common conditions you're treating, and how does it work for them?
There's a broad list of conditions that we treat, and again, it's all evidence-based, as you mentioned earlier. So that's really important for us. We're treating the things that has the best science behind it. The most common condition we treat is patients who've had cancer and had radiation injury to treat their cancer. Radiation is a double-edged sword. You need it to treat the cancer, but it causes some collateral damage to healthy tissues as well. So we see a lot of patients who've had head and neck cancers and had radiation as a result of that, and need treatment for non-healing wounds and bone breakdown in their jaw. We see patients who've had pelvic cancer, both prostate cancer and gynecologic cancers that have bleeding from their bowel and bladder, ulcers and other issues that aren't healing. So that's the most common thing that we treat.
I bet people don't know that. Wait, cancer and radiation treatments? Could you expand on that? Like, okay, pelvic, take prostate cancer. There's a whole lot of men that got radiation to their prostate. Some of them end up peeing blood or pooping blood from damage to other tissues. How does this address that?
Yeah, so our body kind of adapts to the post-radiation state. So you end up with this bladder and bowel that just kind of leak blood and cause problems. You can have large clots and obstruction and other issues there. You can actually hemorrhage to the point that you need transfusions. And your body kind of adapts to that and just says, like, this is me now, and doesn't try to heal that. With hyperbaric oxygen, we trigger some of our body's healing mechanisms, and it says, hey, we got a problem here, and it will have your bone marrow makes stem cells. Those stem cells get produced, their production gets ramped up with the hyperbaric oxygen, and then it travels to areas that have been irradiated, and you build new blood vessels. We don't get you back to where you were before you had the radiation, but we get you to a place where you don't end up in the hospital all the time.
You need a few treatments for that, don't you?
It's a construction project, yeah. So the typical treatment course for radiation injury is about 40 treatments. So our patients are really understanding of it because, again, they've been through cancer and they've had courses of radiation therapy. So it's kind of the same thing.
Mm-hmm.
This is just trying to help rebuild that healthy tissue that you had with the radiation.
And if it reduces some of that sometimes painful bleeding, that's a great thing. Okay, that's cancer. What else?
The other second most common condition that we treat is patients who've had wounds that don't heal. So particularly related to diabetes. So we work really closely with our excellent podiatric surgery team here, and we'll have patients who have wounds on their feet that aren't healing. And they have problems with blood vessels as well. So all these conditions are kind of united in that regard. So
the blood vessel issue. Because people might wonder, well, why doesn't a wound heal? Your body heals wounds, doesn't it?
Yeah. So when you're a diabetic, your body just, again, kind of accepts that this is my state of being and doesn't make the blood vessels that it needs to heal a wound like it did when you were, say, 16. So hyperbarics, again, same kind of mechanism there. It tells your body that, hey, we've got a problem problem here, and we need to build some new blood vessels into that area that is struggling.
Can you talk a little bit about the limb preservation program?
Absolutely. We're lucky here. We have a great team of providers that all work together to get patients the best outcome. So we have got an excellent world-class interventional radiology department. We've got an amazing podiatric surgery department that will do aggressive surgeries to try to help somebody preserve their limb, which helps function.
Yeah, so you don't have to amputate.
Correct. Yeah. So you might lose a toe, but you get to keep your foot. And again, that's so important to be able to get around, to live your life there. So excellent surgical team. And then you've got us. So where the vascular surgeons and interventional radiologists work on the big blood vessels, we work on the microscopic blood vessels. So we have all the resources here. Very proud of all the team that we have and everyone that works together to get patients good outcomes.
Before I get off the wound healing topic, is there any role for the wound preservation program in frostbite? Because we are here in the frozen tundra, folks. We're in the garden spot of the country, otherwise known as Minnesota. People get frostbite.
We are, yeah. Interesting. So I'm from Ohio. I came here, with kind of the understanding of frostbite that you learn in residency, and then, have developed this into something that's really I'm pretty passionate about. So we see a lot of frostbite here in Minnesota, probably more than anywhere else in the world, and have excellent teams taking care of that, and Hyperbaric is part of that. So we've got diagnostic tests that allow us to make the conclusion that somebody's got severe frostbite quickly. And then we've got aggressive thrombolytics that we can use to break that up. And then we can send them to the chamber if they're struggling with healing there.
Let's talk about carbon monoxide, if you could.
Carbon monoxide is the most common emergency that we see in Minnesota. For hyperbarics, So it's the most common emergency treatment that we have. We, in Minnesota, have more accidental carbon monoxide poisoning than we do intentional, which is both good and bad. We're kind of the inverse of some states. It's, again, a product of our climate, just like frostbite. And
why would that be? All this accidental carbon monoxide.
People like to winterproof their gear. So fall and spring, when you're getting your boats in and out of the garage, whatever you end up doing there, or power washing your basement is the big thing.
Power wash? I thought you were going to say ice fishing houses.
We do get that every so often, but it's a lot of power washing the basements.
Power washing?
Yeah, Minnesotans want to get that basement clean apparently. So they have a gas power washer in the basement and just hosing away, and then down we go.
Okay, I've never even heard of that. I always thought it was some guy who's building basically a house out on a lake.
Yeah.
People do that in Minnesota. They do.
Absolutely.
But you got to heat the house, and then you drill a hole in the ice through the floor of the house, and you have to heat it. So there's carbon monoxide. The power washing. So it's anything that is burning fuel?
Yeah, anything that combusts fossil fuels makes carbon monoxide.
And how does hyperbaric oxygen treat carbon monoxide toxicity?
So two ways. The one that my toxicology friends kind of bristle at is, we give super high doses of oxygen. And again, that diffusion gradient that I referenced earlier gets rid of it faster. That's really not where the money is, though. That's not really where the patients see the most benefit. What happens with carbon monoxide poisoning, and again, it kind of all goes, with that radiation injury, with the inflammation, again, it's all kind of united here, is you get this post-inflammatory response to the carbon monoxide poisoning. And we found that when you give somebody hyperbaric oxygen, you can turn down that inflammatory response and prevent some of the long-term effects that happens after you survive your carbon monoxide exposure. And the long-term effects are post-concussive type syndrome, so a delayed neurologic issue. When NFL athletes get a repetitive head trauma, they can have problems with cognition. And it's the same thing with carbon monoxide poisoning. So months to after the incident, people have issues with depression, sleep, and just kind of remembering things. And hyperbarics can turn that down. We've actually seen that animal models, I don't recommend this before you power wash your basement, but in animal models, if you pre-treat a rat before you expose it to carbon monoxide poisoning, you don't have those effects.
Wow. Wow. So there's a public service announcement, everybody. If you are going to burn something in an enclosed space, you might end up meeting Dr. Masters in our very slick hyperbaric oxygen chamber, but you don't want to do that.
That's right. I'd rather meet you somewhere else, yes.
Okay. Before I take a break, there's a lot of buzz online about things like sports recovery, anti-aging. Is there anything there?
Hard to know. Again, we stick to the evidence here. We don't do chronic traumatic brain injury and things like that here. We don't offer those therapies. There are places that are looking into that to see, if there is actual benefit for patients, and I'm interested to see what the studies show. So I'm hopeful in some conditions, and some I'm a little bit skeptical on. But we'll see. Where the science sorts out in the next 5 to 10 years.
Thanks for that. We're talking with emergency medicine and hyperbaric medicine physician Dr. Thomas Masters, and learning all about hyperbaric medicine. We are going to take a short break, and when we come back, we're going to cover what the procedure is like, what risks may come with it, and talk a little bit more about the incredible program here at Hennepin Healthcare. So stay with us. We will be right back.
When Hennepin Healthcare says, "We're here for life," they mean here for you, your life, and all that it brings. Hennepin Healthcare as a hospital, HCMC, a network of clinics in the metro area, and an integrative health clinic in downtown Minneapolis. They provide all of the primary and specialty care you'd expect to find, as well as services like acupuncture and chiropractic care. Learn more at hennepinhealthcare.org. Hennepin Healthcare is here for you and here for life.
And we're back talking with Tom Masters about hyperbaric medicine. So could you talk us through, Tom, what the procedure is like for us? Paint a picture for somebody who's coming into the program and getting treatments.
Our chamber is really designed with patient flow in mind and patient experience in mind. So it's a very nice environment. So you get a consult with one of us. We make sure that you're appropriate to go in there and there's no issues that would keep you from being safe in the chamber, which is, again, safety is kind of our buzzword and the most important thing for us. But once you're cleared and ready to go, you arrive at our department. We have locker rooms where you can get changed into scrubs. The reason we do that is because, again, safety, fire risk is real, and we want to make sure that everyone's going in there is going in there with as low a risk for problems as they can. They get dressed into scrubs. They go and get checked in by our nurses, make sure there's no issues, their vital signs are all good. And then when the appropriate time comes, you get loaded into the chamber. We offer 4 different treatments a day, an 8 o'clock, a 10:30, a 1 o'clock, and a 3:30. And it's kind of like riding the bus. It's pretty predictable. You arrive there every day at the same time. You get loaded in. It's about a 2-hour treatment, and then you get to go home.
You're with other people?
You're with other people, yeah. So you're always in there with a healthcare professional, whether it's one of our nurses, our techs, or sometimes a physician, someone like me or our fellow or one of our residents will be in there with you. So you're always in there with somebody, and usually you're in there with the patients as well. So I mentioned earlier, up to 8 patients at a time. You sit in a recliner.
What do?
You sleep, you read a book or a magazine, or we show a movie. And that's actually the biggest complaint that people have. Sometimes they don't like the movie
They
selection.
don't like the movie?
They don't like the movie.
So it's not in the seat back in front of you. It's like the old airplanes where it's like
it's a shared experience. Yeah. So you have headphones and you watch one of our DVD collection that people have generously donated to our department. So
I don't think I knew that part. But you could sleep if you want, close your eyes, read a book. Do people chat with each other, or is it not comfortable enough to do that?
It's very comfortable, actually. So the only discomfort that you might feel is when you're traveling down to pressure. So for the first 5 minutes or so, when you're increasing the pressure in the room, you feel it in your ears.
I was going to say, what does that feel like?
Yeah, it's like when you're flying on an airplane, when you're changing altitude. So, people yawn, chew gum, whatever you need to do to get to pressure there. But once you get to pressure, it gets warmer at first, again, because you're increasing the atmospheric pressure. So the molecules are getting closer together. But we have a climate-controlled system there, so it cools down and gets to be a comfortable temperature. You put blankets on, you can sleep or do whatever you need to do to pass the time. Our chamber's pressurized on air, so it's an air-filled environment. Again, mitigates the risk of fire. And you breathe the oxygen on a face mask, kind of like a CPAP machine that people might wear when they're going to sleep. You just chill for the next 2 hours on that mask.
Is that about how long? Are all treatments the same length?
So all of our routine treatments are the same length. So I think it's about an hour and 50 minutes that you're sitting down at pressure there. Oxygen's a drug, just like anything else. So different diseases need different doses of drugs. So we control that by both the length of time you're at pressure and the depth that you go to. So you're going to get different doses of oxygen the deeper you go. So you're going to get a higher dose of oxygen there, and then the longer you're at pressure. So for our routine patients, so if you have got radiation injury from a cancer, then you're there for about 2 hours. If you have a central retinal artery occlusion, which is an eye stroke, that's about 2 hours and 30 minutes.
Then you just go home? Or are you in the hospital during this, or do you just walk home?
So our emergent patients are inpatients usually. So the patients with carbon monoxide poisoning, for example, end up staying in the hospital.
They came from their hospital bed and wheeled over to you.
Correct, exactly, yeah. For our routine patients, the ones that we see the most of, they come, they treat, and they go home.
That's super slick. Let's shift gears a little bit you talked about safety.
Yeah.
There's safety about the procedure itself, and you mentioned fire safety. Could you say a little bit more about that? And then I'm going to ask you about personal safety. How safe is it for the individuals?
Yeah, fire safety is super important for us. There have been some tragedies that have happened across the United States here this past year, including a toddler up in Michigan that was involved in a fire. Those are in the monoplace chambers, which again pressurize on 100% oxygen. Those should be very, very, very safe if you follow safe procedures. The places where these tragedies have happened, unfortunately, it sounds like, just from listening to the court reports and everything, there have been some deviations in protocols there.
In the monoplace, it's the thing that looks like a little iron tube.
The iron lung kind of thing there, yeah. So again, you got to make sure that what goes in the chamber is safe. So whether it's clothing or pillows or whatever, you got to make sure that it's safe and non-combustible. So people have wound dressings on it.
All the air in that monoplace chamber is oxygen.
Yeah. So things that, and any pressurized environment, things that won't burn under normal conditions can burn. So we're really cautious about that. You can't bring your cell phone in. You can't bring your Apple Watch in there, again, because the risk of fire is there and we don't want that to happen. So our techs are very strict, making sure that everything goes in there is safe. We're like I mentioned, different because we have a TV in our chamber, but all of the electronics that you'll see in the hyperbaric chamber is flushed with nitrogen gas, which prevents the risk of fire from happening. So we're very cautious about that. We can do everything you can do in the ICU. So all the equipment that goes into an intensive care unit.
It's a little intensive care unit in this thing.
Yeah. So everything you can do in the ICU, we can do in the chamber with the exception of shocking somebody. So patients have specialized equipment that go in there with them if they need IV fluids or medicines. So we can do all of that.
I have been in there and seen sprinkler heads in the top. What is that all about?
Yeah, and that's part of our fire suppression system. So if there's an issue, if there's a fire, we have hoses to put it out, and we've got a deluge system that if you hit a button, it's a torrent of rain that if you're standing 2 feet from each other, you can't see through the water that's coming from the tanks above us. So just a ton of water.
Do you test that? Have you run it?
We do test that. Yeah, we have a quarterly testing where we run that just to make sure that it's working.
Have you been in there during that?
I haven't, but we.
It's like standing under Niagara Falls.
Yeah, our fellows will volunteer to do it just because it is an experience. So
yeah, and they're younger.
Yeah, exactly.
They're in their 20s, so they'll do anything.
Yeah, so just a torrent of water, to make sure that everything is safe in there.
What about to the individual patient? What kind of side effects might people experience?
So generally people feel no different when they leave the chamber. The joke I always give our patients is like, we get a third of the patients that come in and they feel rejuvenated. They're like, look at my skin, it looks younger. And we get a third that comes out and go, I'm really tired. And then we get a third that comes out and feels no difference there. And I think honestly that's a function of sitting in a chair for 2 hours more than the actual oxygen. The effects that it has on us is more subtle and long term. So you're not feeling your bladder rejuvenate because again, it's a construction project that takes place over months. So, you're rebuilding those blood vessels and it's subtle. It happens slowly over time. The real difference that people will notice is, again, with their ears, your voice sounds a little bit different under pressure too. So that again,
is it like breathing a balloon?
The air molecules are closer together, so it's a denser gas. So it's like when you breathe helium, it's those helium molecules traveling over your vocal cords change your voice, so you'll sound a little bit like Mickey Mouse when you're under pressure.
Okay, I didn't know that either. People are getting a picture in their head of this submarine where everyone goes in there, watches a movie, and sounds like Mickey Mouse.
That's right. Yeah.
It's actually very serious medicine, folks. This is as cutting edge as planet Earth has, to be honest. Yep. Can too much oxygen be dangerous?
Yeah, and so it's less so for kind of our routine patients. There are side effects. Again, it's a drug, so every drug has side effects. Right? So we have to be cautious about who we send in there, which is part of the consult. Patients who have underlying lung conditions can have issues with the pressure changes. So if someone has COPD, emphysema, they can have problems with air trapping and have problems with their lungs. So we always get some kind of imaging to make sure their lungs look good before they go in the chamber. Other risks that can happen, it can change your vision, but that's a temporary effect. So you can get these vision changes that last for about 6 weeks or so after you stop the treatment. So actually your distance vision gets worse and your near vision improves. It's called hyperoxic myopia. And then the real scary side effect that we warn everyone about is that you can have seizures as a result of oxygen. The U.S. Navy's done all kinds of studies on this, and it happens. And it doesn't cause any long-term effects, though. It doesn't cause epilepsy or anything like that. We, again, take it very seriously. That's why you're always in there with somebody, a healthcare professional that can take care of you. But, we'd stop your treatment for the day. We'd probably send you over to our emergency department to get checked out, but actually you can resume it. It's super uncommon. It's like 1 in every 10 to 20,000 treatments.
You mentioned the Navy. Didn't a lot of this work happen in the Navy and underwater diving and the like?
Yeah, that's where our roots are. So all the gas testing and everything like that. The Navy is kind of the leader on it because they've got a captive audience of sailors there.
A lot of sailors.
They can use to kind of learn there. So they are big funders of research. Duke is a big beneficiary of their research.
Who isn't a good candidate? Is there somebody who shouldn't do this?
Yeah. For limb preservation in particular, we talk about we're on a team, and our patient is the most important member of that team. So you have to be able to come, you have to be able to do things like stay off your feet. Otherwise, it's spinning your wheels. It's probably not worth the effort that you're expending there if you're coming like once a week. So you have to be able to make it. You have to be able to sit for 2 hours. Other than that, if you have underlying medical conditions, COPD, like I mentioned earlier, that's something we're cautious about, but it's always balancing risk and benefit. So if you have COPD and it's pretty well controlled and you don't have any lung changes on x-ray and you're having a lot of bleeding from your bladder, then it might be worth doing.
It might be worth doing for you.
Yeah. So again, that's why we're here.
But you check out everybody who goes into the program. You get a full a physician evaluation to decide if you might not be the right candidate.
We do, and that's as hyperbarics has been in the news, as this kind of miracle treatment and everything. There's been a lot of places that practice, frankly, some medicine that I find questionable and unsafe. That's not the medicine that we practice here. So, we make sure that, that the patients who go in there are safe. We make sure that the environment is safe. That's really important to us. And that's why it's important to have doctors that are trained in this and a facility that's equipped to handle it.
Yeah, let's shift to that because this is one of the premier programs probably in the whole world. Tell us a little bit more about that. Why is it important that it's available, for instance, 24/7?
Because we see a lot of emergencies, and if we weren't here, the next chamber closest would probably be Omaha or Milwaukee. So it's limited access.
Other oceanic sites.
Correct. Yes. Yeah. So we're a real regional asset to the people in Minnesota and the upper Midwest. We get patients referred to us from North and South Dakota. We need to be here if you have an emergency, if you have carbon monoxide poisoning, if you have that eye stroke. And again, we will see divers too. So every so often we'll get someone who's got a diving related injury or someone who had a procedure that ended up with air in the blood vessels that shouldn't have been there. Those are patients that come to Hennepin.
You get flown in usually? How do they get here? Are they driven in or do they show up on your doorstep?
Depends on the circumstances. But
right.
We work closely. Again, I'm an emergency room doctor by my primary board. So they end up in our emergency department and get assessed. Sometimes they arrive here directly from the Twin Cities, and sometimes they come here from all over. So, we'll see patients from way up north or, western Wisconsin that end up here. So
it doesn't sound common that the 24/7 availability is around in our state. Is that true?
That's very true. Yeah. We're the only one in the state of Minnesota that's available for 24/7
The only one
care.
in the whole state?
Only one in the whole state. Yeah. Yeah. So, some larger health systems, they'll send us their patients. So we're here for that. I think there's about 24 or so places that say they do 24/7 hyperbaric care, but I actually think the number's probably smaller. There's places that have kind of spotty availability. We are here 24/7, 365. I was on call last night and took a few emergency calls. They fortunately didn't need treatment, but, we get those calls all the time.
I think that's worth repeating that right here in downtown Minneapolis at Hennepin Healthcare has the state of Minnesota's only resource for life-saving treatments and for chronic cares that is simply not available anywhere else other than right here. To give credit where credit is due, who are the professionals on your team? I don't mean by name, but what type of people work on your team other than you, the physician?
Yeah, so we have a team of great physicians. I want to give a shout out to my colleagues there. So we've got 6 physicians that are all emergency boarded by our primary boards, and all of us have done a fellowship in hyperbaric medicine. So extra training to make sure that we are available to understand all of these conditions and all the complications and understand who need benefit from treatment and who shouldn't. Our physician team is really important. And then, of course, our nurses are all specially trained as well. So we've got a great team of nurses who have been practicing hyperbaric medicine for years, who have gone to courses to understand hyperbaric medicine and are great and, again, world-class. We have a nurse practitioner, I'll mention her too, who was actually one of our former hyperbaric nurses. She did a 53-hour treatment with a patient one time who had bad omitted decompression sickness. So she was in the chamber for 53 hours.
53 hours?
53 hours with her patient. Yeah.
I'll bet the toilet had to get used for that one.
It did, yeah. And because she had to stay at pressure because of because she was
shout out to her. Can you name her?
Kim Gerber. She's fantastic, and I'm not violating HIPAA or anything because it was in the news, the whole story there. So so she was in there for 53 hours. So I gave a shout out to her, and then we have a fantastic team of techs, both our nurses and techs. We've got literally award-winning nurses and techs in the field of hyperbaric medicine who've done great things to help out to make sure the specialty gets advanced here, and they're right here at Hennepin.
Well, thanks for that. Thanks to all the team in our hyperbaric program, and I will repeat, it's one of the world's premier programs. So let's wrap up, Tom. If you could leave listeners with, one or two most important things, what would you leave them with to remember about hyperbaric medicine?
So I think the biggest thing is being aware of us. So hopefully people are listening to this, and if you have a condition that benefits, talk to your doctor. We are happy to consult. So if you have a condition that, maybe your doctor's been saying that, okay, we're just going to have to deal with this. That's not always true. So if you're having problems with bleeding, with pelvic radiation or any kind of radiation, talk to your doctor and consider us because we are available. And again, we're here to talk to you and help guide you through the process. So be aware, be an advocate for yourself. And if you have questions, we're here. We're a resource for you.
Dr. Tom Masters, thanks so much for sharing this great information. It's actually been kind of fun and informative for me. It's just simply fascinating what a powerful treatment oxygen can be when done by professionals in the right setting in a program that frankly knows what they're doing. So thanks for being here.
My pleasure. Thanks for having me.
And listeners, thanks for listening to the Healthy Matters podcast. We will be back in 2 weeks' time with another great topic. So in the meantime, be healthy and be well.
Thanks for listening to the Healthy Matters podcast with Dr. David Hilden. To find out more about the Healthy Matters podcast or browse the archive, visit healthymatters.org. Got a question or a comment for the show? Email us at healthymatters@hcmed.org or call 612-873-TALK. There's also a link in the show notes. The Healthy Matters podcast is made possible by Hennepin Healthcare in Minneapolis, Minnesota, and engineered and produced by John Lucas at Highball. Executive producers are Jonathan Comito and Christine Hill. Please remember, we can only give general medical advice during this program, and every case is unique. We urge you to consult with your physician if you have a more serious or pressing health concern. Until next time, be healthy and be well.